In the pursuit of a brighter future, we turn our attention to a resource that offers a shining beam of hope to those affected by addiction. Aegis Treatment Centers is one of the largest providers of medication-assisted treatment for opioid use disorder in California. Our guest today is Dr. Brian Talleur, Chief Medical Officer from Aegis Treatment Centers. Welcome, Doctor.
Thank you. Thanks for having me. Feel free to call me Dr. T.
Okay, I will. Dr. T it is. So, Dr. T, can you talk about the power of healing and the approach that Aegis offers?
Yeah, Aegis Treatment Centers specializes in treating patients that are addicted to opioids using medication-assisted treatment. So if somebody was addicted to an opioid and they stopped using it suddenly, they would feel symptoms that felt like a severe cold. So they feel achy, nausea, vomiting, diarrhea, everything that goes along with that. And so it makes it very difficult for a patient to quit on their own. At Aegis, we prescribe medication that helps with the opioid withdrawals, along with individual and group counseling, which try to get to the root of the problem with the goal of long-term recovery.
Yeah, it's good to know that there are those resources to help toward the road to recovery, like you mentioned. And we're hearing so much in the news about fentanyl. Can you give us a big picture look at the fentanyl crisis within the broader context of the opioid epidemic?
Yeah, fentanyl is a synthetic opioid that can be created in a lab. It's 50 to 100 times more potent than heroin. The DEA recently did a study, and they found that fentanyl was involved in more deaths than anything else, more than heart disease, cancer, homicide, suicide. It's also the fake oxycodone that are on the streets. It's very difficult to find real oxycodone. The fake ones that are called M30s have fentanyl in them. And the DEA also discovered that 6 out of 10 of these have 2 milligrams or more, which is a fatal dose for somebody who's opioid naive, who doesn't have a tolerance. So a child, an adult. So it's very dangerous, and it can be in other medications for ADHD, Adderall, Xanax, or benzodiazepines. So, it's very risky, very dangerous. But in the midst of this crisis, there's hope.
Yeah, and speaking of there being hope, how many Aegis treatment centers are there and what areas do you serve?
There are 40 plus Aegis clinics. We treat about 12,000 plus patients a day. We have clinics from as far south as Redlands to as far north as Eureka, and everywhere in between, all around the Sacramento area, all in Central Valley.
And how can those seeking that second chance find out more about Aegis treatment centers?
They can go online and search aegistreatmentcenters.com, call the phone number that's listed. They can also just come into a clinic, and we'll be ready, and we'll be ready to help them. Whether they are ready or not, just come in and they won't regret it.
And paying for treatment is often a hurdle that substance abusers must overcome. Any word regarding healthcare coverage in relation to your services?
Yes, we cover Medi-Cal, Medicare, and many other private insurances. So we're here to serve our community and help our community live a healthier and happier life.
Dr. T, thank you so much for joining us this morning. We appreciate it.
Thank you. Thanks for having me.
You bet. And for more information, you can go to aegistreatmentcenters.com or call that number you see on the screen, 888-815-0747.